Dear friends, once in every 2 to 3 weeks, a couple visits my clinic to seek advice for a very peculiar complaint, and that is inability to perform sexual act, what we call as non-consummation of marriage. I am Dr. Ikshita, consultant gynecologist, and today we are going to discuss the problem of non-consummation of marriage in the women's world 58. These couples usually belong to an age group of 25 to 35 years and they are well educated. They do not come to a doctor due to hesitation, shyness and cultural influence. When they visit a doctor, it's already 1 to 2 months after marriage or sometimes as late as 1 to 2 years. Some of their friends or relatives may coax them and then they visit a gynecologist. Now when they come to my clinic, they do not open up so easily. So as an experienced doctor, patiently and tactfully I encourage them to speak up, and then they say that they tried having sexual intercourse but it was just not possible. So today we will discuss about the causes, why this problem occurs. The causes are of two types: anatomical, which are structural, and functional. So functional causes are those which occur in females where there is no actual deformity of the vagina and the introitus. So the functional cause is there in females in 7% to 20% of these females, and that is called as vaginismus. Don't be scared, it's not a big disease. It's easily treated. Now what is vaginismus? It is involuntary contractions of the muscles surrounding the vagina, and whenever any object like finger or the male genitals, they try to enter this vagina, the surrounding muscles will undergo contraction and that will obstruct the entry of anything into the vaginal opening or the introitus. Now let's come to the anatomy of this vagina. Now as we all know, there is a partition on the vaginal opening which is called as hymen. Now this partition, if you see in this picture, this is the introitus and this is the partition which is called hymen, and this has a small opening which discharges the menstrual blood. This is the anatomy of a virgin or a female who has never undergone sexual intercourse. Now when the husband tries to penetrate through this hymen, because it is small, in the opening is small, she gets pain. Sometimes she may also get slight bleeding, but that is not compulsory. Now with this pain, she just doesn't want to have further penetration and she will just withdraw herself from having sexual intercourse, and there is non-consummation of marriage. Now what is the pathology behind this? Before marriage, she has either read in magazines or she's been told by her seniors who are married, like friends and relatives, that sexual intercourse is extremely painful and the pain is so bad that she will die due to excruciating pain. And then she develops extreme fear or phobia regarding the sexual act. And whenever the husband comes near her or whenever he tries to have foreplay in the region of her vaginal opening, she just pushes him away and does not let him have penetration through the hymenal opening. This particularly occurs in females who are too protective of their body parts and who are shy, and secondly who have tremendous fear about any kind of pain such as menstrual pain or toothache or headache, and with slight pain they take painkiller medicines. So this will be very common in these type of females who have a low pain threshold and who cannot tolerate pain. So how do we diagnose this problem? The diagnosis of the problem is when I take the patient to my examination room and ask her to undress herself, she is hesitant. She just tries to divert my attention and doesn't want to get undressed. So somehow I have to convince her and take her on my examination bed. Now when I ask her to separate her legs, she is not ready. She brings her thighs in the center and does not reveal the private parts to me. When I gently separate her legs and just touch the introitus with the finger of my gloved hand, she just reflexly contracts this area, brings her thighs inside and pushes me away. And that is confirmatory that she has a condition such as vaginismus, and that has come from the extreme fear of anything penetrating through her hymen. So friends, in next episode we are going to discuss about what is the management of this problem of vaginismus and how do we treat other problems of non-consummation of marriage. So friends, please do watch the follow-up episode, that is the part 2 of this problem, and share it with your newly married friends or friends who are going to get married. Please subscribe my channel so that I am encouraged to make more such videos on newer topics. Till then, stay happy, stay healthy. Thank you.